Man diagnosed with bipolar disorder snaps. 12 dead. Sensationalism and media headlines such as this are largely responsible for creating stigma regarding people suffering from mental illness. Chances are we all know someone who's been diagnosed with schizophrenia, bipolar, massive depression, or some anxiety disorder. Whether it's a friend, a classmate, family member, we all know somebody who's suffered. I myself was diagnosed with manic depression, which is now known as bipolar, when I was 16 years old. I understand how the effects of stigma can reduce the recovery process. The way the public reacts to people who are mentally ill often stems from the stigma created by the media. This stigma affects recovery and must be changed in order to assist those struggling to increase their chances for recovery. To begin understanding stigma, it's important to know where it comes from. Stigma and negative portrayals of people suffering from mental illness is created by a lack of knowledge of those that report the news. We've all seen headlines such as this: 1,200 killed by mental patients, or psycho cabbies rampage on CCTV. It's this ignorance and these headlines that do nothing but portray those who are mentally ill as violent criminals instead of simply having a sickness such as cancer. Stigma is triggered by a lack of knowledge and negative influence in the media. Age-old thoughts and stereotypes that we get from movies such as Sling Blade or Dr. and Jekyll and Mr. Hyde create a self-stigma as well as a public stigma for those that are mentally ill. In her book, in the American Psychological Association's book titled On the Stigma of Mental Illness, Practical Strategies for Research and Social Change, the author, Beth Angel, quotes Pat Deegan expressing how stigma has negatively affected her. Pat writes, "All I knew were the stereotypes I had seen on television or in the movies. To me, mental illness meant Dr. Jekyll and Mr. Hyde, psychopathic serial killers, loony bins, morons, schizos, fruitcakes, nuts, straitjackets, and raving lunatics. They were all I knew about mental illness, and what terrified me was the professionals were saying I was one of them." It's this stigma that prevents those who are suffering from seeking treatment. Knowing where the stigma comes from is important, but more important is understanding how it can affect the person suffering from the symptoms of mental illness. Public opinion affects recovery. Often, as I stated, those in need of recovery are scared to seek it because of what they've already seen. Community integration is a great tool to assist those suffering from a serious mental illness, increase their rate of recovery. Often those who are suffering from various disorders and symptoms withdraw and isolate, which only makes things worse. By decreasing stigma and helping public opinion view those that are sick in a better light, it makes it easier for them to integrate into the community. In the Journal of Counseling and Development, Stacy Overton describes how stigma affects a person's ability to manage daily activities. She writes, "The barriers to and negative attitudes toward people with mental illness that result from the stigma process affect them greatly. They are often compromised in dealing with daily activities. After hearing negative feedback and experiencing an onslaught of negative actions, they begin to see themselves in a negative light. People who have been diagnosed with a mental illness often find that their self-image and confidence are sacrificed by living under the pressure and negative expectation generated by stigma." Understanding the harm that stigma causes should move us to compassion. It should give us a better view and help the public towards assisting the mentally ill towards recovery. For those suffering to achieve success, they desire to achieve the success they desire. public opinion has to change. Through education and compassion by those that are mentally ill. We have to treat the mentally ill as people and not just crazy people. We have to educate the public about mental illness. In the book, Don't Call Me Nuts, Coping with the Stigma of Mental Illness, the author writes, research conducted by our own group at the University of Chicago has shown that one of the most effective ways to change public attitudes about mental illness is to foster interactions between the general public and persons with mental illness. Ignorant attitudes are easy to maintain when members of the public do not encounter persons who have overcome their psychiatric disabilities. As the public and mental health workers continue to change the way they perceive the mentally ill, those suffering will be able to move forward with their recovery. When the media changes the way they present problems involving the mentally ill, those suffering will begin feeling better about themselves and live more fulfilling lives in the community.